So Maria has consented to let us photograph her ultrasound, and you can see I'm in what's called the inguinal crease, that break where your groin meets your thigh. This is an area where there's a big vein called the common femoral vein, and I have the probe here. This is an ultrasound probe. It's a sonocyte machine. We've got some ultrasound grease on it, and when I push this in, what will happen is I can compress her vein. So right here I've got pressure on it. I'm looking at the ultrasound machine over here and the readout, and I can see how big that vein is, and I can measure flow through it and so on and so forth. We're going to morph over to the screen, and I'll show you our friend Mickey Mouse here. There are his mouse ears, and then this is the greater saphenous vein, this is the common femoral vein, and then if we turn the color on, we find some arterial pulsations over here. So these are arteries, not what we're interested in today. And as I squeeze her leg, you'll see everything lights up where there's blood flow. And that's normal. And what should happen if I compress this is this big black area should compress. If it doesn't, she's got a blood clot in there. So let's see if she's got a blood clot. Here we go. All gone. But you can still see that pulsation over there. That's arterial over there. So basically we made this black thing go away. I'll take the color out. We'll do it in black and white now. Once again, this is the common femoral vein, the large vein of the thigh, and we're going to press on it. This might hurt a little bit, Maria, and it goes away. So it shrinks down. You can see the artery still pulsating there when I do that, and that's normal. It's still pulsating. All right, so that's normal. Now this is the greater saphenous vein. This one we're interested in, and this is not enlarged. And when I put color on, what we'll find out is if I squeeze, we'll see these things kind of fill up. And what I like to see is that this gets blue and this doesn't, and that happens. That means that this blood is going through here and it doesn't spill over onto this and run back down the leg, causing increased venous pressure. So that's a normal study there. And we can go further down the leg, and we will, and we'll look at things. We're also going to do a test for what's called reflux. So now we're going to take that other vein, that smaller vein, the greater saphenous vein, and we're going to look at it. So let's find it. First we've got Mickey Mouse, and Mickey Mouse looks like he's got a nose or something here, and that's the greater saphenous. So we're going to go after this vein, and I'm going to turn things. I'm going to go after that little vein up top there. Can you find that for us, Blanca? To the left a little. Okay, there's the greater saphenous. And on the count of 3, she's going to hit the Doppler. 1, 2, 3. Good. And you can see that once again, within a half a second or a second, this kind of goes back down. That's a normal pressure tracing. She's not going to need a big insurance procedure with a Doppler, with a laser up inside the leg doing that. So she'll be able to probably get by with something like varicose vein injections for shrinkage. So that's good news for Maria. We're through with the ultrasound. Thank you, Maria. Now if we look at her veins, we find that she has fine veins. If they're super small, we call them spider veins. She's got a couple of those. And then these intermediate sized ones that are often bluish or reddish, we call these reticular veins. And I guess the name doesn't matter because Maria doesn't like the way they look. And when she lies down in bed at night, these kind of hurt her. So what we're going to set her up for is a series of injections. And these injections will be along these veins. And you'd say, well, boy, that's a lot of pokes with these little veins. But in fact, you'll find that if you poke one vein, it's kind of like hitting a tree trunk, and you get into the tree trunk and you put poison in the tree trunk and the whole tree dies. So what we do is we inject some of these things, and there are lots of interconnections. I might give her an injection here, and this much of her leg might in fact then become vein reduced or vein free on the surface and look a lot better. And you can see that she has shapely legs. She's a pretty lady, but with a few less veins she'll be even prettier. So thank you very much, Maria, for letting us show your leg. Okay?
Okay.
All right. Good. Thank you. And thank you, Blanca, my capable ultrasound tech.